Parkinson's is not just a tremor, it's a story of the brain losing control over the moment. In this episode, we will simplify Parkinson's disease, what causes it, how to recognize it early, and what modern medicine can do to improve quality of life. Welcome to Pace Hospital's special podcast. I am Dr. Pramod Kumar, consultant neurologist, Pace Hospitals, Hyderabad. Joining me today is my esteemed colleague who brings a critical surgical perspective to this conversation, Dr. Sandeep Varma.
Hi, Dr. Sandeep Varma here, consultant brain and spine surgeon at Pace Hospital. I am delighted to be part of this important conversation. Parkinson's disease, as Dr. Pramod told you, is far more than just a tremor. It is a disease that affects millions of families across India and the world. And today we are going to break every myth, answer every question, and give you the full picture regarding Parkinson's disease.
Stay with us till the end because we will cover everything from what happens inside your brain to latest surgical treatments to how patients can live a full and dignified life with Parkinson's. If you or someone you love has received this diagnosis or suspect them it, this podcast is for you.
Let's discuss what is Parkinson's disease.
So let us start at the very beginning. What exactly is Parkinson's disease? Most people hear the word and immediately think it's a tremor or a shaking palsy. And yes, that is one of the most visible signs. But the truth is, Parkinson's is a complex neurological disorder, meaning it is a disease of the brain and the nervous system. At the heart of the Parkinson's disease is the death of very specific brain cells called dopaminergic neurons, located in the region of the brain called substantia nigra. These neurons produce dopamine, a chemical that acts like a messenger, sending signals that coordinate smooth and controlled movement. When these cells die, and in Parkinson's, they die gradually, and dopamine production falls. And when dopamine falls, control of the movement breaks down.
To put it simply for our viewers, think of dopamine as the oil that keeps the engine of your movements running smoothly. When the oil runs out, the machine starts to sputter. This is what Parkinson's patients experience. But what I always tell patients is, Parkinson's is not a death sentence. It is a chronic condition. And with the right management, people live very well for decades.
Exactly. That is worth noting. Parkinson's is the second most common neurodegenerative disease in the world after Alzheimer's disease. In India, we estimate over 70 lakh people are affected. And yet, awareness remains dangerously low. Many patients come to us 2, 3 or even 4 years after the symptoms began because they or their families dismiss the signs of normal aging. That is a tragedy we are trying to prevent today.
And it is not just a disease of elderly. We are seeing more and more early onset Parkinson's diagnosed before the age of 50. That is a whole different set of challenges. Patients who are still working, raising children and very active in life. So the conversation about Parkinson's must be had in every household, not just in families with elderly members. What are the causes and risk factors of Parkinson's disease?
One of the most common questions I hear from the patients and families is, why did this happen? What caused it? And my honest answer is, in most cases, we do not yet know the single definitive cause. Parkinson's is what we call a multifactorial disease, meaning it is likely a combination of genetic and environmental factors. Genetics play a role. We know that the number of mutations increase the risk. If a first degree family member has Parkinson's, your risk is roughly 2 to 3 times higher. And this is important. Most Parkinson's patients have no family history at all. So genetics alone is not the whole story.
True, Dr. Pramod. Environmental exposure are increasingly recognized as contributors. Long-term exposure to certain pesticides, herbicides, especially in agricultural communities, has been linked to higher rates of Parkinson's. Head injuries, even repeated mild traumatic brain injury, like those seen in contact sports, are also being studied for their link to neurodegeneration. And of course, age is the biggest non-modifiable risk factor. The risk of Parkinson's rises sharply once the patient touches 60 years of age.
What is fascinating and hopeful is recent research showing that gut health may actually be connected to Parkinson's. The gut-brain axis, the communication network between your digestive system and your brain, may play a role in how Parkinson's develop. Some patient reports constipation and digestive issues years before any motor symptoms appear. This is an active and exciting area of research.
And to be clearer to our listeners, having risk factors doesn't mean you will get Parkinson's. It simply means awareness and early screening are important. If you are above 50 and noticing any unusual symptoms, do not wait. An early consultation with a neurologist can make a world of difference for you. What are the symptoms of Parkinson's disease?
Let us talk about the symptoms. And I want to go deeper than just tremors because Parkinson's is a full body condition. The classic motor symptoms, the one most people recognize from what we call the TRAP synonym, tremor, rigidity, akinesia or bradykinesia, which means slowness of the movement, and postural instability. The tremor in the Parkinson's is typically a resting tremor. It happens when the affected limb is at rest and reduces when you intentionally move it. It often starts in one side of the body, just one hand or a finger or a leg. A classic sign is that we call the pill rolling tremor, a rhythmic movement of the thumb and the fingers as if rolling a small object.
And rigidity is equally debilitating. The muscles feel stiff and resistant. Patients describe it as feeling like these muscles never relax. Combined with slowness, even simple tasks like getting up from a chair, turning over in a bed at night become major challenges. And as the disease progresses, balance is affected, which is why falls become a serious concern and often how surgical intervention enters the picture.
But here is what people miss, the non-motor symptoms. These can actually appear years, sometimes a decade before the classic motor symptoms. And these are often missed as unrelated. What are they? Loss of smell is one of the earliest signs. Sleep disturbances, particularly a condition called REM sleep behavior disorder, where patients physically act out of their dreams. Most mood disorders, depression and anxiety, constipation, excessive daytime sleepiness, and cognitive changes.
And I would like to add for the family members listening to this, watch for a change in their handwriting. Parkinson's patients develop micrographia. Their handwriting progressively shrinks. Also watch for a soft voice, a reduced facial expression, what we call masked faces, and a shuffling walk. These are the early signs that should prompt an immediate medical consultation.
Very true. The earlier we catch, the more we can do. That is a message for every family today on World Parkinson's Day.
How to diagnose Parkinson's disease?
One question I get constantly is, what tests confirm Parkinson's? And my honest answer is, there is no single definitive test. Parkinson's remains a clinical diagnosis. That means it is based on careful neurological examination and the pattern and the history of symptoms. At PACE hospitals, our approach is comprehensive. We take a detailed history, when did symptoms begin, on which side, how they have progressed. We perform a thorough neurological examination, including the assessment of tremor, tone, speed of the movement, gait, and balance. We use special clinical rating scales and also to quantify how the diagnosis is affecting the function.
From a surgical standpoint, we also do imaging. An MRI of brain is important, not to diagnose Parkinson's directly, but to rule out other conditions that can mimic Parkinson's, such as normal pressure hydrocephalus, vascular Parkinsonism, or any brain tumors. We also use a technique called DAT scan, dopamine transporter imaging, which can show the actual loss of dopamine producing cells. This is particularly useful in atypical and early cases of Parkinson's disease.
And one particular test we do is a therapeutic trial of levodopa, the primary drug treatment for Parkinson's. If the patient responds dramatically to this medication, motor symptoms improve significantly. That itself strongly supports the diagnosis. In Parkinson's disease proper, the response to levodopa is excellent. In some atypical forms of Parkinson's, it is not.
What are the various treatment strategies for Parkinson's disease?
Now, the part that gives patients and families the most hope is the treatment. While there is currently no cure for Parkinson's, the treatments we have are extraordinarily effective to control symptoms and maintaining the quality of life. Let me be clear. With good management, the most Parkinson's patients can live active, productive lives for many years. And the cornerstone of this medical treatment is the levodopa, often combined with carbidopa. Levodopa is converted to dopamine in the brain and directly addresses the deficiency. It is still the most effective drug we have, more than 50 years after its discovery. Alongside levodopa, we have a range of supporting medications like dopamine agonists, MAO-B inhibitors, COMT inhibitors. All are used to extend the effect of dopamine and reduce the side effects.
And this is where my role comes in. When medications become less effective or when side effects become difficult to manage. Because in Parkinson's, over time, the response to medication can fluctuate. Patients experience on periods when medication is working and off periods when it wears off and symptoms return. This is called motor fluctuation. This is often the point when surgical intervention becomes life-changing option. The surgical treatment that has transformed Parkinson's care is called deep brain stimulation, DBS. It sounds complex, but the concept is elegant. We implant a tiny electrode, a wire, into a specific target in the brain, most commonly the subthalamic nucleus or the globus pallidus. This electrode is connected to a small battery device similar to a pacemaker, implanted under the skin near the collarbone. The device delivers continuous electric pulses that regulate the abnormal brain activity causing Parkinson's symptoms.
And the results can be remarkable. Patients who are barely able to walk or who had severe tremors after DBS, they can move freely again. DBS does not cure Parkinson's, the underlying disease continues, but it dramatically improves the quality of life. In carefully selected patients, it can reduce medication requirement by 50% or more. And the DBS is not the only surgical option. There is newer completely non-invasive technique called focus ultrasound or MR guided focus ultrasound, where high intensity ultrasound beams are used to create a tiny lesion in the thalamus, providing relief from tremor without any incision. This is particularly suitable for patients who are not candidates for open surgery.
So the message is clear. Surgery is not a last resort of desperation. It is a carefully planned, evidence-based option that should be discussed with your neurologist at the right time. Do not wait until the disease is too advanced. The earlier DBS considered in the course of fluctuating symptoms, the better the outcomes. Importance of rehabilitation and lifestyle changes in Parkinson's disease.
Treatment is not just medication and surgery. What we call multidisciplinary rehabilitation is absolutely essential. Exercise is, without exaggeration, one of the most powerful tools we have in Parkinson's management. Studies consistently show that regular aerobic exercise slows the progression of motor decline. We recommend 150 minutes of moderate exercise per week.
Physiotherapy is central. Targeted exercises to improve balance, gait and posture. Occupational therapy helps patients adapt to their home environment and daily routine. Speech therapy is also critically important because swallowing difficulties and soft speech are common in Parkinson's patients. These can cause serious complications if left unaddressed.
And there is a fascinating evidence now for boxing therapy and dance therapy for Parkinson's. Rhythmic, high-intensity activities that engage the brain in a very specific way lead to measurable improvements in motor function. These are not gimmicks. They are evidence-based, complementary approaches that genuinely help.
And mental health support cannot be overlooked. Depression affects nearly 50% of Parkinson's patients and often goes unrecognized untreated. At PACE hospitals, we ensure every Parkinson's patient is also reviewed by a neuropsychologist. Caregiver support is equally important. The family members who care for Parkinson's patients also face enormous emotional and physical demands, and they deserve the support too. Now let's debug some of the most common myths patients have about Parkinson's disease.
1. Parkinson's is just about shaking hands. No. Only about 70% of the Parkinson's patients have tremor. The rest have predominantly rigidity, slowness, and balance issues with minimal or no tremor. Parkinson's is a full body, full life condition.
Second, the most common myth most of the patients have regarding Parkinson's is Parkinson's only affect old people. That is false. Early onset Parkinson's before age 50 is more common than most people realize. We see patients in their 40s and 50s regularly at PACE hospitals suffering from Parkinson's disease.
3. If you have Parkinson's, you will end up in wheelchair. False. With proper treatment, exercise, and early intervention, including surgical options like DBS when needed, the vast majority of Parkinson's patients maintain mobility and independence for many years.
4. Brain surgery for Parkinson's is too risky. No, not true. In experienced hands, DBS is one of the safest brain surgeries performed today.
5. Parkinson's medication is addictive and should be avoided as long as possible. False and dangerous. There is a common fear about starting levodopa that it will run out or become addictive. This is not at all true. Delaying treatment only allows the disease to progress unchecked. If you need medication, start it under your doctor's guidance.
As we close today's conversation, I want every patient and every family member who is hearing this. Parkinson's disease is not the end of your story. It's a challenge, a real and difficult one. But with the right medical team, the right treatment, and the right support, people with Parkinson's lead meaningful, joyful, and purposeful lives.
This World Parkinson's Day, our message at Pace Hospital is: do not ignore the signs, do not delay consultation, and do not lose hope. Whether it is a tremor you have noticed in a parent, a change in handwriting, a loss of smell, or a balance problem, come and get evaluated. Early diagnosis is the single most powerful advantage you can have against this disease.
Pace Hospitals has a specialized movement disorders program with neurology, neurosurgery, rehabilitation, neuropsychology, physiotherapy, and speech therapy all under one roof. For any concerns, reach us at Pace Hospitals or call us to book a consultation.
Thank you for being with us today. If this podcast gave you even one piece of useful information, please share it. Someone in your circle may be experiencing Parkinson's symptoms right now and not know it. Your share could change their life.